Can you imagine if the key to unraveling the mysteries of mental health lay not only in neurotransmitters, but in something much more fundamental that affects every cell in your body? In his groundbreaking book, Brain Energy, Dr. Christopher Palmer invites us on a journey that redefines our understanding of mental illness, connecting it directly to metabolism. If you're looking for a fresh, science-based perspective on addressing these challenges, this summary will guide you through his most impactful ideas and, even better, show you how you can apply his teachings to your life. Prepare for a deep dive into the mind-body connection and discover why brain energy could be the missing link in mental health. This summary is structured into 3 chapters, where we'll explore the foundations of Dr. Palmer's theory, delve into the crucial role of diet and lifestyle, and finally, discuss how these ideas can be integrated into a holistic approach to recovery. Chapter 1. The Brain as a Metabolic Organ. Palmer breaks with the traditional view of mental illnesses as mere chemical imbalances in the brain. Instead, he proposes a unified theory that positions them as metabolic disorders of the brain. He argues that dysfunctions in energy production and utilization at the cellular level, specifically in the mitochondria, are at the root of many psychiatric conditions. From depression and anxiety to schizophrenia and bipolar disorder. Imagine a car running on low-quality gasoline or experiencing engine problems. No matter how hard you try to fix the sound system or the seats, the fundamental problem remains the engine. Similarly, Palmer suggests that the brain, as an organ that consumes a disproportionate amount of energy, is particularly vulnerable to metabolic dysfunctions. A clear example would be a person with severe depression who does not respond to conventional antidepressants. Palmer suggests that rather than a serotonin deficiency, the underlying cause could be inefficient mitochondria that don't produce enough energy for optimal neuronal function, thus affecting mood and cognition. Another example Palmer uses is the case of patients with schizophrenia, who often present with insulin resistance and metabolic syndrome, suggesting a direct connection between their metabolism and the severity of their psychiatric symptoms. Palmer believes that mental health symptoms may have a metabolic, not just chemical basis. Chapter 2. Diet and Lifestyle as Metabolic Interventions. Having established the connection between the brain and metabolism, Palmer delves into how diet and lifestyle can be powerful tools for restoring metabolic function and consequently improving mental health. He focuses particularly on the ketogenic diet as a therapeutic intervention. He explains that ketosis, a metabolic state in which the body burns fat instead of carbohydrates for energy, can offer the brain a more efficient and clean fuel source, leading to significantly improved neuronal function and reduced inflammation. He thinks of the brain as a city that requires constant electricity to function. If the primary energy source, glucose, is unstable or of poor quality, the city will experience blackouts and malfunctions. However, if you introduce an alternative energy source, such as ketone bodies, which is more stable and efficient, the city can function smoothly again. Palmer recounts stories of patients who, after adopting a ketogenic diet, experienced remarkable remission of symptoms of bipolar disorder or treatment-resistant depression, where traditional therapies had failed. In addition to diet, Dr. Palmer emphasizes the importance of other lifestyle factors, such as regular exercise, sleep quality, and stress management, all of which directly impact metabolic health and consequently brain health. An example would be a patient with chronic anxiety, who not only improves with a low-carb diet, but also sees a dramatic reduction in symptoms. By establishing a consistent sleep routine and reducing stress through mindfulness techniques, this chapter encourages you to experiment with dietary changes such as reducing refined carbohydrates and optimizing your lifestyle by improving sleep, exercise, and stress management to support your metabolic health. Chapter 3. Integrating a Metabolic Perspective into Clinical Practice. This chapter explores how brain metabolism theory can and should be integrated into a more holistic and personalized treatment approach for mental illness. It underscores the need for mental health professionals to go beyond symptomatic diagnoses and consider metabolic testing, such as blood glucose, insulin, and cholesterol levels, as a routine part of the assessment. It advocates for a model of care that combines traditional interventions such as psychotherapy and medication with metabolic strategies, Imagine a medical team that, when treating a patient with a complex illness, does not simply focus on isolated symptoms, but instead seeks the root of the problem in the body's overall physiology. Palmer gives the example of a young patient with recent onset psychosis. Rather than immediately prescribing antipsychotics, which often have metabolic side effects, he suggests thoroughly assessing their metabolic health and considering early dietary interventions that could not only reduce symptoms, but also prevent disease progression and adverse drug effects. This approach does not seek to replace existing treatments, but rather to complement them, offering a more comprehensive and potentially more effective path to long-term recovery. Palmer's vision is that by addressing metabolism, practitioners can unlock new avenues for treatment that were unthinkable under the purely psychiatric paradigm. Based on the insights expressed in this chapter, you should consider discussing with your mental health professional the possibility of including metabolic assessments in your treatment plan and exploring an integrative approach to your well-being. In conclusion, Brain Energy is a transformative read that challenges our long-held conceptions of mental health. By connecting mental illness with metabolism, Dr. Christopher Palmer not only offers new understanding, but also a hopeful path to recovery. His ideas invite us to view the brain not as an isolated entity, but as an integral part of an interconnected bodily system. By exploring and applying the principles of brain energy, you have the opportunity to not only manage symptoms, but also address the root causes of your mental health challenges. It's time to look beyond the obvious and embrace the power that lies in optimizing your own metabolism. Your mental well-being could be more closely tied to your energy than you ever imagined. If you enjoyed the video, give it a like and subscribe to my channel for more content like this.